Camilla came into the clinic today to see me. She was interested in some rejuvenation for the face. During the consultation, what I like to do is to educate my patients on what happens with aging. As you get older, you lose fat in the face, and particularly certain areas like the mid-face, the temples, and of course you lose fat in the lips as well. So in my view, my philosophy is that it's very important to address all of the aesthetic units of the face. So a combination approach is the way I like to treat patients because they get very natural looking results. So I described to Camilla the benefits of adding some volume to the tear trough, which is under the eyes, adding a little bit of volume to the mid-face to smooth what we call the OG curve and improve the shape of the face, and also restoring a little bit of volume in the temples, some volume in the lips as well. And then to finish off, the form of resurfacing that I recommended to Camilla is called a TCA chemical peel or trichloroacetic acid. And when we inject fillers under the eyes, for example, I feel that pain relief is very important. So I do nerve blocks to numb the area completely. So it's very important and it's very unforgiving if you don't treat the tear trough or the under eye area correctly. And when it is treated correctly in experienced hands, it can be a very dramatic rejuvenation and make somebody look years younger. We use a different filler for the mid-face than we use for the under eye area because the filler has to be a more robust form of hyaluronic acid that will usually last for up to a year. Similarly in the temples, the skin, the fat and the muscle is quite thin in this area. So knowing the anatomy in these areas is very important for an effective, safe rejuvenation for these patients. Finally, lip enhancement. Lips are a very sensitive area, so I routinely perform nerve blocks, somewhat like the dentist would, so that there's complete comfort during this delicate procedure. I use the tenting technique for Camilla so that she gets just a little bit more fullness, but still keeping them nice and natural looking. I finished off with the TCA chemical peel today for Camilla. This is a nice, quick but effective form of chemical resurfacing using trichloroacetic acid, which coagulates the proteins in the epidermis. And this allows a peeling of the very top layer of skin over the subsequent 3 to 8 days. This will mean her skin is brighter, it's cleared of the brown spots and the superficial pigmentation. And so after about a week, she will have brighter, clearer skin, and that will really enhance the results of the volume restoration that we did. Adding all these injectables together, combined with a nice chemical resurfacing in Camilla's case, I think will give her a very nice result. Already she's very pleased with her experience at Venus Medical.